Hi everyone, thanks for listening to my presentations. Today I'll be talking about tuberculosis and the skin manifestations. Let's go. There's what we call tuberculosis verrucose cutis, found in extremities, particularly the fingers, dorsum of the hands, solitary, painless, or violaceous, or could be brown red, mostly indurated and warty plaques. What we need to do is histopathological examination, and we give anti-TB medications. Immediately, the medication starts working, we will see the improvement in symptoms and signs. Others are scleroderma, tuberculosis, cutis orificius, lupus vulgaris. We can also have tuberculous gumma, and that will include tuberculous abscesses, and that is due to hematogenous spread to subcutaneous tissue. In acute miliary TB, we can find tuberculosis, cutis, miliaris, disseminata. That will be a kind of hematogenous dissemination of bacilli from the lungs. This is very common in children, and particularly in adults with impaired immunity. Tuberculosis, cutis, miliaris, disseminata from dissemination. Tuberculids. This is found in people with good immunity to Mycobacterium tuberculosis. There will be no staining confirmation, but tuberculin skin test will be positive. When you do histopathological test also, it will be positive. And you know what? When you give your anti-TB medications, that will solve the problem. Others are papillonecrotic tuberculid, lichen scrofulosaurum, erythema induration of basin, and primary inoculation TB, also known as tuberculous cancer. When you find any cases and you are suspicious that this skin lesion is related to TB, you can have Mycobacterium culture done, which is the gold standard. You can take smear for AAFB using xenazine acid-fast staining, and you can do biopsy. Now take skin biopsy for histopathology. Also, tuberculin skin test, mantle techniques using preferred protein derivative or RC23 is welcome. So you find skin lesion and it's suspicious that the person has taken BCG recently. No? Then have serological test done, that is interferon gamma release assay. That will help in diagnosing latent TB infection and is not influenced by the BCG taken. It might be false positive, however, in Mycobacterium marinum and Mycobacterium capsaicin. If you are not satisfied with the result of the samples taken before now and you are still highly suspicious that the skin lesion is related to tuberculosis, you can have polymerase chain reaction done. It's a form of nucleic amplification for Mycobacterium DNA. So we use that when smear sample testings have failed. So your TST, IgRA, culture, they are all not working. Then result to polymerase chain reaction. However, not all countries have this. Sometimes you are alone in remote parts of the world where you can get all these tests that I've mentioned earlier done. But maybe fortunately for you, you have INH, rifampicin, pyrazinamide, ethambutol, and pyridoxine available, then administer them. Okay? If it is TB related, the cutaneous manifestations will be resolved. However, that will not resolve tuberculosis. With that, I've come to the end of this short presentation to deal with cutaneous manifestations of tuberculosis. Refer appropriately to higher center. Thanks for listening. Kindly subscribe. Check my channel for other TB presentations.